Hi there, I'm Joe Ty from Values Coach, and I want to thank you for inviting me to make a few comments about our work helping healthcare organizations move from a culture of mere accountability toward a culture of ownership. And of course, in healthcare, accountability is important, especially in healthcare where lives are at stake. It's important, but it's not enough. How do you hold people accountable for the things that really matter, like pride, caring, compassion, enthusiasm? Those things have to come from within. You cannot hold people accountable for that. They have to hold themselves accountable. Otherwise, they're just renting a spot on the organization chart and not thinking like partners, not thinking like owners. Accountability is extrinsically imposed motivation. Somebody looking over your shoulder, holding your feet to the fire. Think of the metaphors that we use for accountability. Ownership, on the other hand, is intrinsic motivation. It's walking across hot coals because you believe in the mission and the vision of the organization. In both cases, somebody's feet are at the fire. The difference is it the manager having to hold the feet to the fire, or is it the individual walking across hot coals? And the problem with an excessive focus on accountability is that it can so often backfire instead of starting a fire. And we've seen it over and over. An initial focus on accountability, at first you get a pop in patient satisfaction or whatever you're focused on, but then you backslide. And sometimes you backslide back to a point even worse than where you were before. And I've come to believe that's for two reasons. One, an excessive focus on accountability sends a very subtle but very unmistakable message to people they can't be trusted to hold themselves accountable. You have to be looking over their shoulder, holding their feet to the fire. Number two, and maybe it's even more subtle but perhaps more dramatic, is it is simply exhausting. It takes a lot of hard work, a lot of emotional energy to always be holding people's feet to the fire, to be checking up on them. Did you do the script the right way? Did you make the rounds the right way? And eventually people just get tired. They give up and you backslide. Whereas when people are doing something because they have taken a sense of ownership, you can divert all that management energy, instead of looking over their shoulders, to doing something that's more productive. One of the reasons that I think my book, The Florence Prescription, has taken off the way it has, and we have more than 200,000 copies in 500 different healthcare organizations, and we've really just gotten started, is that whole focus on a culture of ownership. As one example, Fairfield Medical Center in Lancaster, Ohio, has adopted the 8 essential characteristics of a culture of ownership. Things like commitment, engagement, passion, pride, fellowship. And they've made it what they call their employment brand. You go to their recruiting website and the first thing you see are banners with those characteristics. Even more impressive are the stories you hear from individuals. Last year I was able to speak at the Ohio Organization of Nurse Executives at their annual conference, and I did the keynote. Cece Peters is a nurse at Fairfield Medical Center who I've told her story a lot because she made tremendous personal transformation as a result of reading that book. I was able to introduce her to 450 other nurse executives, and she got a standing ovation. What kind of a message do you think that sends back to the organization about the power of this culture of ownership? One of our CEOs, Paul Udemark, is the CEO of the hospital in Geneva, Nebraska, Fillmore County Hospital. And he sent me a note and he said, I got a whole new team and didn't have to change any of the people. Just by changing our focus from accountability to ownership. And you know what? He's had a positive impact on every number they measure. And more important is the impact they're having on the things that they can't measure. Pride, compassion. And those are all reflected again in patient satisfaction, their community image. It is so important in today's world to get people on board. You cannot afford to have people thinking and acting like hired hands. We need to have all hands on deck. We need to have people thinking and acting like partners in a culture of ownership. If there's anything I can do to help you, just let me know.